what are those tiny black holes that are present in your tooth, what is actually causing them, how they are getting formed. I am going to tell everything about it. Hi, I am Dr. Abhishek Chakravarti, Managing Director and owner of Roots Dentistree Dental Clinic, and today I will be talking about the dental cavity. Dental cavity, also known as tooth decay or dental caries, is basically formed by the millions of bacteria that are already present in our mouth. Now these bacteria are the basic normal commensal bacteria of our mouth, which helps in breaking down the food particles so that we can easily digest them. Now what happens when we increase the carbohydrate intake in our diet or the sugary intake in our diet? These bacteria try to break down these sugars by releasing acid. Now these acid basically, when it falls onto the tooth surface, it starts a process of demineralization. Now this demineralization, slow and steadily, it starts eating away the tooth structure layer by layer. Now, tooth is basically comprised of three layers. So the topmost layer being the hardest layer, known as enamel. So it helps in breaking down the food particles, hard food particles specifically. Second layer comes the dentin, which is more of a resilient structure. It acts like a shock absorber. And the third part is the core of the tooth, which is called as the pulp. It is nothing but the housing of blood vessels, nerves and lymphatics. Nerves, as we all know, it provides sensation to the tooth. Blood vessels, it provides food and nourishment to the tooth, and lymphatics, they are basically the drain line of the tooth. Now, when the bacteria releases this acid, the demineralization, first and foremost, it starts with the enamel. And if it is not stopped at that level, it will further progress, reaches to the dentin, where we start feeling sensitivity in the tooth, and then finally, if it again progresses into a more advanced stage, it can reach up to the level of the pulp. Now, when it reaches to the pulp, there is acute pain which will be felt by the patient. And if the process is happening for a long period of time, this process will be a very slow progressing process, so the pain sensation might not be even felt. If it is happening at an immediate thing, so there will be an acute pain. Now, if the decay is only at the level of enamel and dentin, then we can easily do a restorative procedure and we can stop the further progression of the caries. Now, we also call it as a filling procedure. So we can use several varieties of cements. There are so many number of varieties of cements are present in the market, coming from the cosmetic cement to glass ionomer cement to silver amalgams. There are so many other cements that we can use for this filling procedures. Now, if in the advanced stage, if it has gone up to the level of the pulp, the only therapy what can be done at that particular time is root canal treatment. Because the bacteria has invaded the nerves, and the nerves and the blood vessels are now infected with the bacterial toxins and metabolites. Now, we cannot let these metabolites and toxins to spread further in the body or to the other tooth. So, in order to save the tooth, we need to initiate a process which is called as the root canal treatment. In root canal treatment, basically, we sterilize the tooth. So, we will remove the entire decay till the level of the pulp wherever it has come. We will explore the canals. We will measure the canals, we will clean and shape the canals by using mechanical devices as well as chemical irrigants, and once that is done, with a sterile inert material, we are going to fill the canals. So this process completes the root canal treatment. Now with the root canal treatment, the entire area or the passage area from where the bacteria can enter and progress into the other parts of the jaw or to the other tooth is completely blocked. So by root canal, we keep the tooth structure steady at its position to perform, the tooth can perform its normal form and function. It can also give the shape to the jaw, and the infection is also taken care of. Now, the only thing what we need to think about is, as soon as possible we see any kind of dental caries or a black spot or a black mark or a whitish spot or a brownish spot in our tooth, we need to rectify it, immediately visit your dentist. We need to get it either filled, and if it has progressed up to the level of the pulp, then we have to do root canal followed by a crown. And to maintain so that your teeth doesn't get any kind of cavities, you have to maintain a proper oral hygiene routine, that is brushing 2 times daily. Along with that, you have to do flossing, and also mouth rinses needs to be done. This is all from my side.